Doctor, with your expertise in rheumatology, you know how current acute gout treatments are a constant compromise for your patients between pain relief and tolerability. That's why I'm excited to introduce you to Colchris. I'm sure you noticed the pictures around us, all these tough characters showing how refined they can become. Let's discuss how Colchris combines toughness and refinement in the treatment of acute gout flares. You may not be used to thinking about refinement when it comes to gout, but Colchris is here to change that. It's as tough on gout flares as you'd expect from colchicine, but is a refined treatment with an improved tolerability profile. With new Colchris, we're bringing a bit of sophistication to the treatment of gout. While colchicine has been used for generations, Colchris is the first and only FDA-approved colchicine product that meets modern standards for safety and efficacy. Let's talk a bit more about how Colchris is tough on pain. Colchris is the only FDA-approved treatment for acute gout flares to have demonstrated significant pain relief in less than 24 hours. Pain relief was defined as a greater than or equal to 50% reduction in pain scores. Doctor, the gentle power of Colchris is a result of applying scientific discipline to validate a more precise way to use colchicine. As the AGREE data shows, we've developed a gentle way to deliver the power of colchicine. The AGREE trial shows the benefit of the recommended Colchris dosing. Patients treated with Colchris experienced fewer GI side effects than those treated with high-dose colchicine. Experience of diarrhea was just 23% with Colchris, compared to 77% with high-dose colchicine. Colchris showed no incidence of severe diarrhea versus 19% with high-dose colchicine. Nausea was 4% versus 17%, and vomiting was 0% versus 17%. Doctor, as you know, since the first use of colchicine for the treatment of gout, balancing the benefit and risk of GI toxicity has been problematic. In the past, patients who were already experiencing extreme pain from their flares had the added discomfort of diarrhea or other GI upset from colchicine. The simple recommended dosing of Colchris is the gentle therapeutic touch needed for a refined treatment for acute gout flares. With the FDA approval of Colchris for acute gout flares, dosing is simple. 2 tablets to start, followed by 1 tablet 1 hour later, so you can now prescribe with confidence. Doctor, combining the gentleness of milder side effects with the power of colchicine makes Colchris unique. It's the first and only FDA-approved form of colchicine available for the treatment of acute gout flares to significantly reduce pain within 24 hours. And remember, Colchris dosing is simple. Patients take 2 tablets at the sign of a flare, followed by 1 tablet 1 hour later. I'd like to leave you with the Colchris prescribing information. It's important to note that Colchris is contraindicated in patients with renal or hepatic impairment who are currently taking certain medications. These patients should be monitored. Doctor, is there anything else I can tell you about the gentle power of Colchris?
Thank you, Doctor, for sharing with me the background on your rheumatology practice and how you've been using colchicine to manage the pain your patients feel when experiencing an acute gout flare. Today I would like to talk to you about treating those patients with new Colchris. Colchris received FDA approval in July of this year as the only approved single-agent colchicine product. Doctor, when most people think of gout, refinement is not something that leaps to mind, but that is why Colchris is unique. Just like this tough biker character can seem out of place in a sophisticated setting, colchicine is known to be very tough on gout and not very tolerable. But Colchris is a new way to look at acute gout treatment. It's as tough on gout as colchicine, but with an improved tolerability profile. Let's talk about how Colchris is tough on pain. Here we see this tough guy cutting a rug with agility. Colchris is a blend of strength and agility too. Colchris is the only gout treatment to have demonstrated significant pain relief in less than 24 hours. Significant pain relief was defined as greater than or equal to 50% reduction in pain scores. The efficacy data from the pivotal AGREE trial demonstrates in this graph that Colchris and high-dose colchicine were similarly effective in relieving the pain associated with acute gout flares. Doctor, the refinement of Colchris is a result of scientific rigor applied to validate a more precise way to use colchicine. Just like this tough guy playing in an elegant string quartet, we've developed a disciplined, gentle way to deliver the power of colchicine. The AGREE trial shows the benefit of disciplined dosing. Patients treated with Colchris experience fewer GI side effects than those treated with high-dose colchicine. Experience of diarrhea was just 23% with Colchris, compared to 77% with high-dose colchicine. Colchris showed no incidence of severe diarrhea versus 19% with high-dose colchicine. Nausea was 4% versus 17%, and vomiting was 0% versus 17%. For patients with mild to moderate kidney or liver dysfunction, no dose reduction is required, but it is recommended that these patients be monitored. No dose reduction is required for those patients with severe kidney or liver dysfunction, but you should know that they should not be treated with Colchris more than once every 2 weeks. Doctor, as you know, since the first use of colchicine as a treatment for gout, suggested maximum daily doses have ranged from 4.8 milligrams to 10 milligrams, and balancing benefit and risk of GI toxicity has been problematic. However, now when it comes to treating gout flares, a little refinement goes a long way. This tough guy biker has just the touch of class he needs to fit in, even in the most elegant settings. And the simple recommended dosing of Colchris is just the therapeutic touch needed. Doctor, with the approval of Colchris for acute gout flares, dosing is simple. 2 tablets to start, followed by 1 tablet 1 hour later. So now you can prescribe with confidence. It's important to note that no dose reduction is required for those patients with severe kidney or liver dysfunction, but they should not be treated with Colchris more than once every 2 weeks. Doctor, proven flare-stopping power with a mild tolerability profile makes Colchris the acute gout treatment that is tough as ever, but a bit more refined. It's the only FDA-approved form of colchicine available for the treatment of gout flares to significantly reduce pain within 24 hours. Thanks to the pivotal AGREE trial, you can now prescribe Colchris confidently, knowing patients experience significantly fewer GI side effects than with colchicine. And remember, Colchris dosing is simple. Patients take 2 tablets at the sign of a flare, followed by 1 tablet 1 hour later. Here's the Colchris PI. I'd like to bring your attention particularly to the important safety information around the contraindication and dose adjustments in patients with renal and hepatic impairment. Doctor, thanks for your time. I appreciate you giving me the opportunity to talk to you about Colchris. For your next patient with an acute gout flare, can I count on you to try Colchris? Doctor, thanks for your time. You can keep this dosing card to help you remember how simple it is to use the gentle power of Colchris. After generations of inconsistent dosing of colchicine, the recommended dose of Colchris offers elegant therapy with simple dosing. This tough guy biker has just the touch of class he needs to fit in, even in the most elegant settings. And the simple recommended dosing of Colchris is just the therapeutic touch needed for a refined treatment of gout flares. Doctor, with the approval of Colchris for acute gout flares, dosing is simple. 2 tablets to start, followed by 1 tablet 1 hour later. So you can now prescribe with confidence. Remember, doctor, Colchris is the only FDA-approved form of colchicine available for the treatment of acute gout flares. It significantly reduces pain within 24 hours and combines the gentleness of milder side effects with the power of colchicine. Now you can prescribe Colchris confidently. Colchris dosing is simple. Patients take 2 tablets at the sign of a flare, followed by 1 tablet 1 hour later. Refer to the enclosed PI and note that Colchris is contraindicated in patients with renal or hepatic impairment, and these patients should be closely monitored. Doctor, is there anything else I can tell you about the toughness and refinement of Colchris? I hope I can count on you to remember Colchris for your next patient who presents with gout.